Very much. Since the chair sat for many years with the ranking member on this bill, and as my good friend Chairman Adderhold noted, I know it fairly well. I think I'll withhold my questions for now in the interest of time. And so, Dr. Burgess, we'll go to you for any questions you might have for our witnesses.
Thank you, Chairman. I think this is the first time we've had a labor HHS appropriations bill up here in a long time.
Been a while.
It's been a while, hasn't it? That's why it's worthy of note, and I appreciate you working on it and bringing it before the Rules Committee, because I think this is an important part of the process. Chairman Adderholt, I was glad to hear you discuss the holding back funding for gain-of-function research. This, as we work through the issues that have happened in the last 3 or 4 years, this is one thing that continues to crop up, and certainly funding of gain-of-function research, certainly funding in an adversarial nations is something that I think we need to look at extremely critically. So I'm grateful that you included that in your discussion. I'm also glad to see the focus on programs that have not been reauthorized and how you're attempting to pull back rather than just rubber stamp continued appropriations for unauthorized programs or programs whose authorizations have long expired. I am on an authorizing committee. We do need to do our work. We need those programs that are valuable. We need to reauthorize, send them to the appropriations committee to be funded, and if they can't be demonstrated to be of value, then it is incumbent on the authorization committees to do that. But I don't know if you have any other thoughts on that, but I was glad to see you included that in your discussion today.
Yeah. Well, thank you for mentioning about those programs that are unauthorized, and that's something I think this Congress has continued to look at, and I think certainly that's a real starting point where we can do a lot of work. And so I look forward to working with you as you continue your time here on how we can try to work on that more.
You know, you mentioned life-saving medical research in your opening statement, and that is critically important. Have an amendment to the bill, which likely will not be made in order, even though all the power I hold at the Rules Committee. But really, we have to look going forward. The Inflation Reduction Act gave enormous power to Health and Human Services, Center for Medicaid and Medicare Services, and they are in the process of creating a massive PBM, which will be bigger than any pharmacy benefit manager anyone has ever seen. And look, PBM has kind of become a 4-letter word in the past couple of years because of the restrictions they place on the practice of medicine. But now we have a whole agency that is going to be creating de novo an entire bureaucracy staffed with hundreds and hundreds of people that will do nothing except prevent future investments in scientific research. And the reason I say that is we had a roundtable in the Budget Committee on just this issue with the Inflation Reduction Act. And, you know, the fact that we've got this new maximum fair price that came to us in the Inflation Reduction Act, that's not a figure that anyone has ever dealt with before. In fact, it is entirely made up by the Secretary of Health and Human Services. But that is what is going to govern whether or not companies are able to invest in future research and future discoveries. We heard quite clearly that, yes, you may be focused on one particular medication, whether it be a breakthrough or a generic, but the decisions made on that will have significant downstream effects on stopping or curtailing research in other areas. Again, both blockbuster and generic drugs as well. So this is something that I hope in the future we can look at. I tried to limit it as with an amendment. Probably not going to be successful in doing that, but going forward, we really do need to look at what CMS is doing in creating this massive new bureaucracy to stand between doctor and patient and their prescriptions.
Thank you.
Thank you. I'll yield back, Chairman.
Thank you very much. The ranking member.